Hello, I'm Daria and I'm presenting Avicenna Math. Our product is datasets of environmental quality parameters in correlation with the level of infection, disease, and speed of recovery. The physical parameters of air determine the conditions for the transfer of the virus and life cycle of the virus. We fight an invisible enemy. Air quality, physical factors of environment, temperature, humidity, lighting, noise may adversely affect people, especially patients and staff of hospitals. A negative effect can be expressed in the progression of nosocomial infection, as well as in the progression of occupational diseases in the medical personnel. Avicenna Math is software package for assessment of the impact of environmental factors on health, disease risk assessment. Avicenna Math workflow is built at the junction of medicine, physical chemistry, and mathematics. It is based on the dependence of the progression of various human diseases risk on the physical environmental factors and air quality. Our service is for medical and social institutions. It detects and warns of an increased risk of spreading respiratory tract infection, viral and bacterial, assesses the risk of disease for healthcare staff and patients. Avicenna Math is an analytical part of our IoT and cloud platforms of different air quality monitors. Workflow of the platform is rather clear. Collected data from sensors and human goes to cloud and is analyzed there. So our customers are provided with different analytical indexes, for example, disease risk index from Avicenna Math. The use of Avicenna Math in combination with the clinic's information system will allow you to develop and implement a strategy to eliminate sources of indoor pollution and reduce risks to the health and productivity of healthcare workers. Moreover, you will maximize the motivation of employees, the efficiency and safety of medical institutions. Great analytical and research work has been done on the topic of financial losses from personal diseases. Avicenna Math service will increase the effectiveness of your strategy in preventing losses associated with the nosocomial infection among staff and patients and with iatrogenic complications caused by poor health of staff. The most valuable features of Avicenna Math are mobile sensors of control and simplicity, completeness and transparency of analytics. Here you can see the example of design and deployment of our solution for the intensive care unit of the hospital. Here is our current price offer. You can see a calculation example for intensive care units for 12 beds. The methodology is based on research publications and international regulatory documents and recommendations of international organizations. This is Stanislav Liensu, Avicenna Math CEO, Doctor, Cardiologist, Candidate of Medical Sciences. He is an author of the method and Medical Director and Djinn Sensor. Stanislav is ready to answer to any of your questions. Here's our full stack team that includes 12 members of different skills. Our team is waiting for active participants who want to work on the safety of their home and workplace.